The Valdese Task Force continues to issue recommendations for new services and improvements to existing services on the Valdese campus. The latest improvements that have been approved include repair of the existing running track adjacent to the hospital. Task Force member and Cancer Center manager Joseph Rodriguez explains.
We continue to promote wellness in the community by refacing that track surface. As we repave and increase access to that park, if you will, we're going to also look at having different phases where potentially we bring in other play equipment for children, potentially dog park. But the most important thing is that we are looking at having the resurfacing start here relatively soon.
The Blue Ridge Healthcare Foundation donated $30,000 for the track renovations and has allocated $5,000 additional dollars for new park benches and trash bins. Also approved, new rehabilitation services for oncology patients, a program certified by the National Survivorship Training and Rehabilitation Program, known as STAR.
When we look at oncology patients, either at their initial diagnosis, through their treatment, or even in their follow-up care, there is this idea that we underutilize currently the rehabilitative services that they could potentially benefit from. So it is an education program for providers. It is teaching them how better to identify those needs for oncology patients, and then making that appropriate referral to rehab services so those patients could benefit from rehabilitation.
The third approved recommendation, a medication management clinic. Here again, Joseph Rodriguez.
Right now, there is a real high rate of patients being discharged from the hospital and then having to return because of either medication improperly being utilized or not really having left the hospital with a proper education. So the concept is we're going to start looking initially at anticoagulation therapy. As patients either initiate that care here in the hospital, there is very often a period of time, first few days, weeks, where the management of that dosing, that medication, plays a critical role in how effective it is. So the idea is that an initial referral would be made when the patient leaves the hospital to a med management clinic, where they would meet with a PharmD pharmacist, and that individual could monitor their blood levels, advise them about how best to manage their dosing, and provide a little more education beyond what that patient would receive upon discharge. And the idea is that we successfully sort of recurve that potential for them being readmitted to the hospital.
And the fourth improved recommendation, a low-dose CT lung screening program. Valdese Hospital's chief radiology tech is Nikki Martin.
Right now, lung cancer is our #1 cancer in this area, and there is not a diagnostic tool to screen for that early on. Right now, our detections are usually later on, and the success rate is not where we would like it to be. We're pursuing the ACR accreditation and the low-dose CT lung screening.
The task force continues to meet, formulating dozens of improvements, upgrades, and new services for our healthcare center of the future. Much more to come, so stay tuned.